Hello everyone, my name is Amir. I'm the Hematology Registrar. Welcome back in the Hematology Bleeps. Our today's topic is splenomegaly. Sometimes we find splenomegaly incidentally on our scans, or sometimes it is a disease manifestation as well. And the reason for splenomegaly can be both hematological and non hematological. So whenever you find a splenomegaly in the CT scan or ultrasound scan, then my request would be to exclude the non-hematological causes of splenomegaly first, and then if you have no reason, no secondary causes for splenomegaly, then you can discuss with hematology to make a hematology referral or to be seen by the hematology team. So, splenomegaly can be a manifestation of many other conditions like infection, chronic liver disease, and the rheumatoid arthritis. I mean, the autoimmune disorder like rheumatoid arthritis and the sarcoidosis, etc. So, if the patient has any symptoms of infection, it will be very obvious. If the patient has Epstein-Barr virus infection or CMV infection, patient will have symptoms according to that, right? Like upper respiratory tract infections, etc. If patient has endocarditis, then they can have splenomegaly as well. Patient would have cardiac manifestation for that. If the patient has any disease like leishmaniasis or malaria, TB, then the patient will have symptoms according to that, which the medical team can sort out. If the patient has any symptoms related to chronic liver disease, they would be jaundice, they would have hepatomegaly, and obviously splenomegaly as well. And in rheumatoid arthritis or in sarcoidosis, they will have autoimmune related symptoms, which will be very, very obvious. So, these are the few causes of non hematological causes of the splenomegaly. You can see splenomegaly with splenic abscess as well. Maybe there is no systemic infection. The patient may have infection inside the spleen sitting over there. So it can lead to splenomegaly as well. Then, among the hematological causes, almost all hematological conditions can lead to splenomegaly if it is hemolytic anemia or leukemia, lymphoma, hemoglobinopathies, HLH, etc. It can all lead to splenomegaly. But the important thing is that we should exclude the non hematological causes first. Sometime we have seen referrals where the patient has splenomegaly and the team thinks that this is only because of the hematological reason and they refer the patient to hematology. If you are unsure, then let's discuss with us. If you have a secondary cause, then treat the secondary cause and the splenomegaly will go away. But if you have no cause for the spleen and spleen is less than 14 centimeter, better to repeat the ultrasound scan in 3 to 4 months time. If the size is static or if it has reduced by a centimeter or two, then better to arrange serial scans for your patient to see what happened to this spleen. But if the presentation spleen is very, very big, like more than 14 centimeter, or on the repeat scan, the spleen size get enlarged, then um, then you should contact the hematology that this patient need to be seen by the hematology team, either inpatient or as outpatient, because there is no secondary cause and the spleen size is increasing on the repeat imaging, or the spleen size is very big, more than 14 centimeter, and we do not have any secondary cause for that. There is no splenic abscess, there is no autoimmune disease in this patient, there is no infectious cause, and there is no liver disease. So in that case, then hematology is obliged to take over this patient and to see why this patient has a big spleen on presentation. Um, then, as hematologist, They are required, the hematology team is required to see the blood film of the patient. If the full blood count is abnormal, a patient has splenomegaly, then the full blood count then the full blood count should show something. Maybe the white cell count is high, or the hemoglobin is low, or the platelet count is high, etc. Then the blood film should show you something, and the blood film microscopy is important. As I mentioned, all lymphoma, leukemia, hemolytic anemias, they can present with the splenomegaly. So they have their specific features on the blood films. You will be well aware about that. So if there is no cause on the blood film, and patient still has splenomegaly, then the hematology usually arrange a bone marrow biopsy for the patient to find out whether this patient has any low level LPD, low level lymphoproliferative disorder or not. So this was the hematology bit. For the other team, medical team, surgical team, obstetric team, non-hematological teams, if they see a patient which has splenomegaly and there is no secondary cause and the spleen size is less than 14 centimeter, they should repeat the scan um, in 3 to 4 months time. If the spleen size is increasing, then this would need a hematology referral. If the spleen size is static, then this patient may need further scans in the future as well to keep an eye on the spleen. If the spleen size is regressing, that is better. But if you have a secondary cause for your splenomegaly, like this patient has any Epstein-Barr virus infection, or the patient has endocarditis, or the patient has leishmaniasis, malaria, etc., then this patient should not be referred to hematology for splenomegaly because you have a cause. If the patient has chronic liver disease because of any cause, chronic liver disease must have a lot of causes, and it leads to splenomegaly. This is secondary to chronic liver disease. Hematology should not be involved in this one. Yes, this splenomegaly will have a lot of implications on the full blood count, because of which you can come to us, because this big spleen will consume the platelets, will consume the white cells as well. The patient usually have cytopenias, then that's fine. But for the splenomegaly, that this patient has a big spleen, this does not need a hematology referral because you have chronic liver disease sitting there. And if on ultrasound scan the patient has splenic abscess, treat the abscess. There is no need to refer to hematology. And if the patient has chronic liver disease, if the patient has chronic autoimmune disease like sarcoidosis and rheumatoid arthritis, they are known to cause splenomegaly. Felty syndrome in rheumatoid arthritis is known to cause is a known cause of splenomegaly and sarcoidosis as well. The other autoimmune disease may be linked to the splenomegaly as well, but I'm not very sure about that. The rheumatology team may know about that. So this was a small talk regarding the splenomegaly cases, and the main message in this talk was which patient need to be referred to hematology for further workup, and which patient need to remain under the parental team for the treatment of splenomegaly. Thank you very much. If you still have any question, you did not understand this talk, let's believe hematology. Thank you.